So this is an interesting one as well. The physician who posed this question does not have any kind of very, very healthy individual, physically, mentally, doesn't have any kind of substance use or really any, she's probably one of the healthiest overall people I know. So she looked at this situation and said, well, this person can't be free at all if they're, what's free about having to use a substance to prevent withdrawal, and is being dependent on a substance real? I mean, do you have any autonomy? What came to your mind for that question, or if you received that question for somebody, what would you say?
Well, again, I think we seem to make a distinction about drugs like opiates and the hard drugs, and a bit of a different distinction with alcohol, with tobacco, with the more socially acceptable drugs. Because I think there are a lot of people whose behavior that they exhibit would suggest that they don't have that control with, let's say, alcohol, for an example, because we've talked about that a fair amount on our show, that alcoholic behavior is it's so compelling that it's like sort of a magnet straight to the liquor store.
Mm-hmm.
And are they going to die immediately? Probably not,
mm-hmm.
because there's a safe supply of alcohol in our province.
Right. Yeah, but lots of people did die during Prohibition.
But lots of people did die during Prohibition. Absolutely,
from drinking toxic booze. But that's
unlabeled, sort of a random sample of alcohol that they would have received, right? Yeah.
Yeah.
In 1929, American law enforcement is proclaiming Prohibition a success. But most Americans don't buy it.
The editor of the Detroit Free Press, Malcolm Bingay, he wrote that it was extremely difficult to get a drink in Detroit during Prohibition. You'd have to walk into a bar and shout really loudly above the noise of the crowd so that the bartender could hear you.
To satisfy a thirsty nation, gangsters like Al Capone operate illicit distilleries and smuggle in liquor from other countries.
Hard alcohol could be imported from Europe, from Canada, from the Caribbean. It could be something that was sold at a fairly high price point to eager consumers.
Demand barely falters. And targeting the middleman, the bootlegger, isn't enough. As more and more industrial alcohol is rerouted to the speakeasy market, the federal government intensifies its efforts to curtail demand without threatening supply.
The country can't run without industrial alcohol. It was in everything from perfume to laundry detergent. This is the primary source of illegal alcohol in the country. So what the government then looked at was, can we do something to this alcohol that makes it much riskier to drink, and use that essentially as a chemical enforcement of Prohibition.
December 25th, 1926. A man runs into a New York City emergency room, crying that Santa Claus is chasing him with a baseball bat.
And then he shortly thereafter dies, and you have 65 other deaths in the same day. Charles Norris, the medical examiner of New York City, determined that all 65 of them were due to additives in industrial alcohol that had been required by the federal government.
Among the additives is methyl alcohol. More than unpleasant, it's a poison.
Methyl alcohol is very dangerous because when your body breaks it down into some uniquely poisonous compounds. Some of the hazards are going to be blindness, dementia, and of course the last horrible effect is you're going to die.
One could say, and some people did say, that the federal government itself was a willing party in the poisoning of people because they were adding this to alcohol that they knew was going to be repurposed and sold as beverage alcohol.
Charles Norris made a public statement directly accusing the U.S. government of poisoning American citizens, a minimum of 10,000 deaths nationwide.
It sparks outrage across the nation. Over the course of the next year, deaths from industrial alcohol rarely leave the headlines.
So that's what that was the first thing that came to my mind, was like, how do we distinguish between alcohol and tobacco and then hard drugs that put someone at a more immediate risk of death, though alcohol and tobacco are a much more certain, if that addiction is sustained and long term, that it's far higher risk.
Well, both are more lethal than we've talked about this before. You could have a heroin habit until you're 90, and I mean the person with a daily or chronic alcohol or even a tobacco problem is going to die sooner than that opiate person.
Yeah.
That's my assertion. There's not a lot of evidence because there's not a lot of trials, but that would be my guess. Could be wrong, but the point is, you're right. We do have different kind of expectations for our behavior surrounding different drugs. You can't say somebody who's a cigarette smoker has no autonomy. That would be
definitely not. Of course they do.
This person is still making decisions left, right, and center, and yet if they decide to quit smoking, they're going to experience unpleasant withdrawal symptoms.
Mm-hmm.
That doesn't mean they are an automaton. Just like the example I used is an antidepressant. In a way, my freedom is reduced by the fact that I'm taking an antidepressant, and I realize this. I'm sort of beholden to that substance, right? Because I could decide, I could wake up tomorrow and be like, I'm not going to take it for a month. I've done that. And when I've experienced, I've done it cold turkey like that. And then I've done a taper off venlafaxine, and the taper was definitely the way to go. But in both cases, I gave it some time and I looked at it. I was like, no, I still think the benefit is greater than the risk. So I decided to be beholden to that substance because it's providing me with a coping, another level of coping skill, or not skill, but just shields. It's giving me, it helps me cope with everyday life. But that doesn't mean that my freedom has been, perhaps it's been reduced on a tiny scale, but it doesn't mean that I don't have any freedom at all.
Certainly not.
And that could be said of even a drug that needs to be, here's another problem with fentanyl. It has to be dosed often, right? So if you're talking about something that you really want to be chained to, that would be, fentanyl is one of those ones where it's in and out. It's got to be taken often. And this is an area where a safe supply could get in there. If you gave these pharmaceutical companies a chance to develop, imagine the magical injectable opiates they could come up with, right? If there was an incentive to produce recreational opiates, my God, you'd have different release profiles. You'd have these evergreen substances that were like half hydromorph, half new synthetic, whatever. It would go on and on and on. It would be an entire industry. And yes, you would still be physically and probably to some degree psychologically, if you were a chronic user, addicted to those drugs or dependent on them, whatever you want to say. And yes, that would reduce your ability to, travel without them or go to places where they weren't legal. But it's not a complete and utter loss of autonomy. So that's how I looked at it. But it's a good question because in some cases, I think our legal system and the indirect effects of having to procure that substance under these legal parameters, and the indirect effects of being homeless, your nutrition is out the window. You don't have the safe place to sleep. You've got your personal hygiene is gone. You have no safety from other people, or there's just a million other reasons why your freedom to just live your life pursue freedom and happiness is being reduced. And some of it has to do with the drug, but a lot of it has to do with the rest of the system there too. And much of it could be remedied if the drug was legal.
Yeah.
For God's sake.
Yeah, I was just thinking like withdrawal is one of the reasons that puts someone at risk for going back and reusing that same drug and risking overdose, but it's also 100 other things.
Mm-hmm.
Stressors, life circumstance, environment, and those things, those are variables that in some cases we do have control over and can mitigate the risks associated with. Not associating with certain people, or not going in, not going a certain way where you're gonna pass the liquor store, or avoiding a group of people altogether. And then sometimes for individuals, there are also life circumstances where they're kind of stuck. And I think that's where we see such a difference too in the risk and the mortality of individuals who are employed, who are deemed, sort of high functioning, and in our case, healthcare professionals who are
That's right.
addicted to a substance versus someone who's out on the street. And those variables there, the choice is there for both groups, but the factors that sort of surround them and that would compel them to make some of those choices and that would put them at higher risk are also very, very present.
Yeah, present and vastly different.
Yeah,
like it's look at us, for God's sake. I mean,
yeah,
here we are. Yeah, everything's okay.
Yeah.
We're ticking along, even doing a podcast about it. I mean, this is not something that is available to everybody who's in those circumstances. So
yeah, to say the least. So.
Mm-hmm.